You know, we want it, but we want more, and we want to combine things to it. And Leslie, I know one of the things that you're passionate about is adding checkpoint inhibitors to PARP inhibitors. There's a study called Tapasio. Tell us about Tapasio.
Yeah, Tapasio takes this to the next level. So this is PARP inhibitor in addition to PD-1 inhibitor, pembrolizumab. And the PARP inhibitor is niraparib. And this, at the current time, they're looking at both breast cancer patients and recurrent ovarian, platinum-resistant recurrent ovarian cancer
And that's
patients.
the beauty here, because remember I said in platinum-resistant disease it shouldn't work. Right.
Right, exactly. So Tapasio was presented at SGO, and it does in fact work. And interestingly, their signal not only in the biomarker positive groups and adding your PD-L1 biomarker here to that molecular signature with HRD, also a signal in those who are biomarker negative on both fronts.
So what's the response rate of PD-L1, niraparib, and platinum-resistant recurrent ovarian cancer in these? About?
Overall response rate is about 12 to 20%, but this needs to be further studied, especially in ovary.
And studies ongoing.
Studies ongoing. This needs to be expanded to have a larger ovarian cancer cohort, but it's certainly worthy of further study.
So here's what people say, and I know you're going to jump on me, is, well, the Mediola trial, which is olaparib, durvalumab, is 70%. So when you tell me that this is 2025, that's half.
Yeah, I think you have to look at the differences in the populations. So the Mediola was looking at a platinum-sensitive population, and we've been talking all day long about how our PARP inhibitors are effective in these, and what is the addition of the durvalumab.
And a biomarker
we're not
positive.
sure. Exactly, in a biomarker positive group. And so this is, Tapasio is a completely different approach in the resistant population, which is an unmet medical need.
Now, Tom, I know you're passionate about adding PARP inhibitors with an anti-angiogenic. She says PARP-IO. Maybe PARP angiogenic. What do you think?
Yeah, I mean, I think it's interesting, right? Because there's preclinical data in all these areas of these combinations of PARP with anti-angiogenics, PARP with the IOs. You know, the IO interesting story there is that you may change the sensitivity,
neoantigens.
by creating these neoantigens, increasing the mutational load, and then coming in and hitting it with the PARP. I think that, with the IO, I think the interesting thing is some of the studies that are out there. So there's a study known as ANOVA, and that's looking at PARP plus or minus, with niraparib plus or minus bevacizumab. Cool. They did a phase 1, phase 2 program. We should have data early next year. But it's really an interesting strategy, right? Because what you're doing is basically sparing the patient platinum in a platinum-sensitive setting. Cool. Which is really an interesting strategy, and frankly, the response rates and the duration of responses that we're seeing, I think, make that a strategy that should be looked at.
And that's being expanded in the Ovario study, right?
Right. So Ovario is basically taking a NOVA study, and again taking niraparib and putting those patients on Bev or not, this time in the platinum-sensitive maintenance setting.
It's great.